The brow lift is not so much a treatment area as it is combining two areas to get a desired outcome. The phrase brow lift in toxin treatment is poorly understood by patients and practitioners alike. From looking at people's faces who I meet, I am betting a huge number of practitioners are selling their patients brow lifts but are actually getting the treatment areas wrong because of a simple misunderstanding of facial anatomy and the actions of toxins. Brow lifts with toxin should position the brow up and outwards. They improve the position of the lateral brow higher in relation to the lateral part of the orbital rim. This enhances beauty and gives the appearance of a more open eye. A well-performed brow lift is a thing of beauty. Eye makeup goes on great, the brow arch looks fierce, and your patient will love you. That's if you treat the right areas, of course. Let's roll back to the very beginning and remind ourselves of what botulinum toxin actually does. Botulinum toxin relaxes muscles. Repeat after me. Botulinum toxin relaxes muscles. Great. So now let's have a think about relaxing the individual areas and what effect that would have on the position of the brow. Relaxing the glabella, so the brows go apart and up. Relaxing the frontalis, brows go down, potentially. Relaxing the lateral orbicularis oculi, brows go up and out. So with that in mind, a brow lift cannot reasonably originate from treating the frontalis, because relaxing this muscle would do the exact opposite to what you want to happen in a brow lift. Let's think back to what frontalis treatment does. Treating the frontalis makes a smooth forehead, yes. Treating the lateral parts will cause muscle deactivation here and restrict brow movement. So that's not really what we want to do. An option would be to treat the middle section of the frontalis as normal and leave the lateral parts untreated or lightly treated, like what you would do in a high-risk lid laxity case. That might just work, but if your patient doesn't have any heaviness and the brow mobility is normal, you will get compensatory activation of the lateral frontalis. This means you turn one muscle group off whilst another is still on and trying to do the job of both. Also, this effect will only raise the brow in animation, so when the muscle is trying to move. In the case of a medial frontalis deactivation and a lateral frontalis activation, you'll very quickly get brows like Spock. It is a brow lift of sorts, but whether that's attractive depends on what planet you're on. It's safe to say that trying to achieve a weird-looking brow lift by using a compensatory activation of the lateral frontalis is sloppy at best. So you can see that relaxation of glabella and periorbital would be a better way to get a favourable and aesthetically pleasing reposition of the brow. Deactivation of glabella and lateral periorbital areas will cause a favourable upwards and outwards lift of the whole brow. So the golden rule of toxin brow lifts is treat the glabella and periorbital, leave out the frontalis. Brow lifts are not only effective for enhancement of beauty, but also when your patient is not an ideal candidate for frontalis treatment due to risk. If you've already a lax eyelid and brow ptosis, you want to be doing everything in your power to try and open the eye a little bit and a toxin brow lift might give your patient a small improvement in appearance. Yes, you can still treat the frontalis if you like and tag on the third area, but caution, as soon as the frontalis is involved in treatment, the lift will be less effective. Let's look at how to treat them. Is it as simple as combining glabella and periorbital? Yes, kind of. But what we need to consider is using the injection points for maximum up and out lifting in both areas. Here's the injection points. The glabella follows the standard points we discussed earlier, unless you have a horizontal crease at the radix, in which case you can add a further injection point for the procerus. So every site in the glabella takes 4 units. Remember how I told you earlier that relaxing part of the orbicularis oculi, the circular muscle around the eye, is like letting go of trampoline springs and relaxing wedge-shaped parts of the muscle? This is what we need to do here. In order to get that nice upward and outward lift, we need to relax a broad section of the lateral orbicularis oculi. So for a brow lift, I would use the standard lower 2 points to the lateral canthus and below. Then the upper injection site, I split into 2 by 2 units to get a broader spread, but also more relaxation in the upper parts of the muscle. The final injection site that I add is the mid-brow into the hair-bearing area. I inject this point intradermally. What we must understand is the orbicularis oculi is a circular muscle, so it's not just the medial and lateral parts that are active, but the whole of the muscle. So placement of that little unit here in the middle can make all the difference. It will achieve relaxation of the midpoint of the brow and stop inward pull by catching the tail fibers of the corrugator supercilii and the orbicularis oculi in this area. The injection techniques are the same as for the areas of glabella and periorbital, so make sure you go back to these videos and revise these so that you can achieve predictable and safe results. Glabella injection is 90 degrees to the muscle in procerus, and corrugator injection is between 30 and 45 degrees, both at around 3 millimeters needle depth. Gently deposit the toxin, making sure you inject away from the eye and have a finger rest at all times. Periorbital injection should be superficial to result in blebs of product under the skin. An injection angle of up to 10 degrees, introducing the needle tip just under the stretched skin and pointing the needle away from the eye will deposit product in the correct depths. Finally, the single unit into the mid-brow is at intradermal depth, again at a shallow angle. You'll appreciate that in addition to understanding which muscles achieve which outcomes, thorough assessment preoperatively, so taking into consideration their skin quality, muscle movement, brow position and mobility, lid laxity, asymmetry and patient history is vital. Caution! The midpoint of the brow injection must remain superficial. An intradermal bleb, which is into the skin only, like you would place on the lateral periorbital injection sites. Placement of too much or too deep in this area can cause a brow or even lid ptosis, which is where the eyelid does not fully open. The upper points on the periorbital injections need to be placed with respect for the safety margins, as diffusion into the lacrimal gland can cause dryness of the eye. So that concludes our brow lift video. Let's move on to the next one.